Should I try to link in again?
Yeah. I got it.
No one is letting me in. Keep circling. The call is being recorded. Okay, good. So I can join. If you could let me in.
Yeah.
Good. I'm.
Can you listen my voice?
I can put my phone down. Right? You hear me? Okay.
Yes, we can hear you, doctor.
Yes, it is not clear. Okay. I got it. Today's talk is reposition of Montelukast.
When I'm ready, let me know.
Yeah. Again disappearing. The slide is disappearing. Yeah. My title of my talk is Reposition of Montelukast either alone or in combination with levocetirizine against SARS-CoV-2. It is not moving. Next slide, please. Yeah. Abstract. It has been hypothesized that anti-allergic medications, AMS, like Montelukast and levocetirizine, both the two beta chloro compounds, could be repurposed either alone or combinedly as an antiviral against SARS-CoV-2, like chloroquine, hydroxychloroquine, another two beta chloro compounds. Both AMs and CQ and HCQ are beta-tested chloro compounds. Depending on these beta-tested these two similar physical properties and the safety and efficacy of AAMs by controlling over post-viral episodes, as comparing with viral inhibitory activities including SARS-CoV-2 by chloroquine, hydroxychloroquine. A reposition of AAMs, either alone or combinedly, could be rationalized as an antiviral approach to nCoV. Next slide, please. Yeah. In the introduction, COVID-19, commonly referred to as the novel coronavirus or simply the coronavirus, a new virus showing a respiratory illness like pneumonia or severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, is a causative agent for corona disease 2019, that is called COVID-19, who declared a highest global health emergency on COVID-19 on 30th January 2020. That time, outside of the China, only 98 cases of positive were found. But today, that means on that day, 16th June, when I communicate the paper, the figure is totally opposite that time. That was world is overwhelmed by more than 80 lakhs infections and 4.3 lakhs death. The rate curve of world confirmed cases of COVID-19 and confirmed death from COVID-19 showed still steeper that time. No flattening the curves were observed. Medical professionals are facing direct challenge due to unprecedented power of spreadability of the virus. At that moment, humanity and world economy are totally paralyzed by lockdown. There were no other ways except masking, hand washing, and social distancing. Only the way to wait for a specific medication and or a vaccine to defeat the virus. Currently, there are no FDA approved vaccines available for COVID-19. Clinical trials and case reports have yielded moderate results repurposing antiviral therapies used in unrelated viral infections, but further investigation is required. Next slide, please. Anti-allergic medications. Anti-allergic medications, a combination of montelukast and levocetirizine, could be effective antiviral against COVID-19. Montelukast, a known antihistaminic, antileukotriene, anti-allergic drug, may have some viral inhibitory role to control COVID-19. Need to explore, as recently reported by Yong Kang Chen et al. 2020, that it can irreversibly inhibit the infectivity of Zika-like flavivirus, and reported by Ahmed A. et al. 2018 that it can reduce dengue-like flavivirus shock syndrome. Levocetirizine may stop cytokine storm as it inhibits the production of intracellular adenosine molecule 1, in abbreviation ICAM1, and secretion of interleukin IL-6 and IL-8, which may have beneficial effect on the pathophysiological changes related to human rhinovirus, that is called HRV, infection in airway epithelial cells. Flaviviruses, HRV, and nCoV have common type of genetic material, that is single-stranded RNA. Both montelukast and levocetirizine, the two bitter chlorocompounds like chloroquine, hydroxychloroquine, as CQ has bitter taste that was described by Hans D. Northrop and Kevin C. Kane. And HCQ, it leaves a horrible bitter taste in the mouth, reported in India Today Inside. Next slide, please. CQ exerts direct antiviral effect, inhibiting pH-dependent steps of the replication of several viruses, including members of the flavivirus, retroviruses, and coronaviruses. Also, montelukast can treat recurrent respiratory symptoms of post-respiratory sinusitis virus bronchitis in children. Montelukast attenuates the frequency and severity of episodic wheezing in child patients due to upper respiratory tract infection caused by adenovirus, influenza, metapneumovirus, coronavirus, etc. Inventor Bruce Chandler described in his European patent that combination of levocetirizine and montelukast formulation are effective for treating influenza, common cold, and associated acute inflammation. Mike Young Kim et al. 2018 reported that a 4-week double-blind rationalized multi-center phase 3 study was conducted to compare montelukast monotherapy as versus combination therapy with montelukast plus levocetirizine in a cohort of patients with perennial allergic rhinosinusitis and mild to moderate asthma. Resulting a fixed dose combination of montelukast plus levocetirizine was found to be safe and effective for the treatment of perennial allergic rhinitis and asthma compared with montelukast alone, according to the research. Next slide, please. SM Atsule et al. 2010 has reported in his review that the new generation antihistaminics are all safe with negligible sedative effects, excellent tolerability, and have no influence on cardiac parameters. Montelukast, when used as monotherapy, is efficacious and improves quality of life. Combination therapy, montelukast plus levocetirizine, is a more effective strategy than monotherapy in the treatment of persistent allergic rhinitis. Conclusions: since AMs and CQ-HCQ both possess bitter taste and chloro group, depending on these two similar properties, I would like to hypothesize that there is a chance for repurposing these two bitter chloro, montelukast, and levocetirizine compounds alone or combinedly against SARS-CoV-2, like chloroquine hydroxychloroquine, as both CQ and HCQ can inhibit SARS-CoV-2 and SARS-CoV, that is MERS and SARS, before and after infection, which was reported by Kathleen A. Patrick et al. 2020. Next slide, please. Next slide, please. Yeah, next slide, please. Yeah, it is reference. Next slide, please. Next slide, please. Continuing reference. Next slide, please. Next slide, please. Yes, this hypothesis was uh, accepted 2020 June 24th and published online 2020 June 28th and published in Medical Hypothesis Elsevier, Volume 144, 2020 November issues. Also, it is approved by WHO under Global Literature on Coronavirus Diseases. The ID bearing COVID WHO 627612. Next slide, please. This abbreviation. Next slide, please. Special notes, perennial allergic rhinitis is a chronic allergic condition that does not subside throughout the year and causes nasal congestion and runny nose. You may feel like you have a permanent cold that wouldn't go away. And bronchiolitis is also a disease always caused by a virus. The condition most commonly occurs during the winter months, an inflammatory bronchial reaction in young children and infants. Next slide, please. Yes, it is structure of AAMs, that is anti-allergic medications, according to PubChem. Montelukast, it is molecular weight 586.2 and levocetirizine molecular weight 388.9. And both the structure we can see, there is a actually chloro group. In Montelukast, here is the chloro group, and in the levocetirizine, here is the chloro group. And rest of the 3 oxygen atom common in both structure, but here is 2 nitrogen in levocetirizine and here is only 1 nitrogen in the Montelukast structure. Next slide, please. Yeah, it is the chloroquine and hydroxychloroquine from PubChem. The chloroquine molecular weight 319.9 and hydroxychloroquine has molecular 335.9, and both the structure has chlorine group common, chloro group, and only difference in hydroxychloro group, a polar hydroxyl group is here, but here is no hydroxyl group in case of chloroquine. Next slide, please. Known function of Montelukast. Actually, Montelukast, how it works? It is also called leukotriene receptor antagonist. It is an inflammatory action. It is a bronchodilatory, anti-allergic, anti-ischemic, and anti-arrhythmic. MLK, that means Montelukast selectively blocks cystenyl leukotriene 1 receptor. Second important function, MLK prevents binding of inflammatory mediator leukotriene D4, resulting in inhibits leukotriene mediated inflammatory events. Next slide, please. Yeah, known function of levocetirizine. It is also non-sedating drug, selective histamine H1 receptor antagonist, antihistaminic function. Also, it has anti-inflammatory function, anti-angiogenic, and blocks allergic reaction by blocking histamine release. And at the end, the R enantiomer of citrizine greater affinity for H1 receptor than citrizine, and granted by FDA approval in 1995. Next slide, please. Yeah, it's my own institute. Next slide, please. Yeah, it's my institute. Next slide, please. The end. Next slide, please. Thanks. Thanks to all and Pride Conference Committee.